Hi everyone, Hannah here from Preferred Physical Therapy, where we help people aged 40 and above stay active and independent, live free from painkillers, and avoid surgery. This week, I'm hopping on my educational video to talk to you guys about fall prevention. And I know this month we've been touching on the topic of vertigo and balance, and if you feel like you're experiencing any of these, don't hesitate to reach our office. A lot of people are surprised that physical therapists can work with vertigo and can actually treat vertigo. And oftentimes, if it is just straight BPPV, then it takes maybe 2-3 sessions and things are good. Now, there are some cases where it does take a little bit longer to heal. Maybe there's other issues going on aside from just true vertigo. Maybe there's more balance concerns that we're noticing. But either way, during a evaluation, if you're coming in for either vertigo or balance issues, we're going to look at how your stability is in a variety of positions, starting from easier, such as feet together, to a little bit harder, more of like a staggered stance, and then to full foot in front of the other, and then balancing on one leg. And then we can also throw in having you guys do it with eyes closed, or standing on like a foam surface or a pillow, something to challenge your balance a little bit more. So that's what we would look into a little bit more at the evaluation, seeing where your true balance deficits are. And then based off of what we find there is where we go on to create an exercise program tailored towards you and towards what deficits or what issues that you're having. And I'm not sure if the others touched on this, but your balance it comes from 3 different systems. It comes from our vision, our vestibular, and from our proprioception or muscles. And we want to make sure that we are strengthening all 3 of those. Yes, we can even strengthen the vision and the vestibular systems. There are different exercises that we can do to kind of retrain the eyes and the vestibular system to help give you a little bit more stability or more focus with different head movements and things like that. Oftentimes, patients will come in with balance deficits and we find that they are weak. Maybe their balance deficits are because of how weak their legs have become. Maybe it's from some disease or some pathology. Sometimes it can just become from normal aging. As we age, our balance starts to decline. Not only that, but our vestibular system starts to decline. So there's a lot of different aspects as to why people will start to experience falls. So aside from just working on holding different balance positions, standing in one spot, we want to make sure that we're also doing dynamic movements. So even just like you'll see in here, people walking heel to toe and different things like that. So different ways to challenge the balance in more dynamic or more functional movements that oftentimes will lead to falls, such as standing there, maybe looking up and reaching up into the top cabinet. Maybe looking up like that is something that could cause a fall for you. So we want to make sure that we are working on those things to help strengthen it up and obviously to reduce your fall risk. And also, we want to make sure that we are working on any strength deficits too. So we will definitely be adding in a variety of exercises to help strengthen up the legs, and especially with the hips and the glutes. That's where a lot of our stability comes from. And oftentimes we don't realize it until we get in here and we're going through the evaluation and we notice how weak your hips and your glutes are. And those muscles, those big powerful muscles, will play a huge role in your overall stability, how you're standing, how you're walking, and different aspects like that. So aside from all of the clinical things, a couple other things that I want you to be aware of if you feel more unsteady or if you've maybe experienced a fall or two is sit back, take a look around your house and see what's going on. See if there's any throw rugs on the ground. See if you have maybe your little puppy or your little kitten running around and they like to zoom in between your feet, maybe throw off your balance. Another thing could be if your dining chairs are on wheels. There's a lot of different things that you want to start looking out for and start making the appropriate changes to prevent any future falls. And it's simple things like that. If you do love having a carpet on your floor, you can easily buy those two-sided tape thing just to keep it more stable on the ground. That way it's not going to flip up or have like a little lip to it where you could catch your toe or something like that. So start making some of those preventative changes around the house. If you do look around, it's like, oh my gosh, I could trip over that, I could fall over that, I could slip here. So make sure that you're just being aware of your environment and your surroundings as well. So I hope that had helped a little bit in just a brief understanding of what we would look at as far as your evaluation if you were to come in with any vertigo or balance deficits, and also just some easy changes that you can do around the house. Now, if you are experiencing falls, have issues with vestibular system, vertigo, even just normal balance issues, you can always contact our office to get a little bit more information about what we can do for you. You can always head over to our website, give our office a call, even looking at our Technique Tuesday videos. I know I touched on a couple easy balance exercises that you can start doing at home. So take a look at all of those resources, and don't forget to subscribe to our social media. But I hope that you guys have a wonderful Friday and a great weekend, and looking forward to seeing you guys soon. Bye.